The final movement of the MamasteFit Birth Prep Circuit is our most active position, which is our supported standing hip shift breathing drill. And so in the supported standing breathing drill, we can use a yoga block, or you can just do the floor. You can also use like a stack of books. We're looking for like 3 to 4 inches, and this is going to help you find more intensity in this movement. With the opposite hand of the elevated foot, you're going to grab onto your sturdy structure, or even hold onto like your partner's hands. You can use your door frame, for example. And then we're going to start with just finding a hinge position. So I'm pushing the hips straight back, finding length through the lats, through this arm. So some folks will have more of a bend in this arm. They're just kind of like hanging out here, but we really want to be able to sink back into the hips. Then we're going to bend in the support leg, which is going to allow you to bring that hip towards the straight leg or the elevated foot. So we're thinking belly towards thigh. You should already feel a big stretch here in the hamstring and glute. And then to intensify it, to find that internal rotation, I'm going to put weight into my big toe. And then I'm going to rotate the knee in without moving the foot. So weight's in that big toe, knee is rotating in. This should already really intensify it, especially here in that back hip pocket. So we're thinking weight in the big toe, knee is rotating in, feeling a stretch here all through that back side of the leg, really rotating that belly towards thigh. And then the last thing is to push the belly and chest away from the floor to find more rounding in the back. And then we're going to think big inhale all through the back side of the body. We're going to feel it more here towards that back hip pocket. And then exhale to release, or exhale, pull ribs and pelvis closer together so we can find more of a rounded position. So this stretch is diagonal through the back. It's through this back hip pocket. It's like deep in the glute, and then all the way down this hamstring. And so what this movement is doing is it's targeting that posterior pelvic floor asymmetrically. So it's targeting it more towards one side, so that left posterior or right posterior quadrant. It's also forcing your hip into internal rotation, which is important to open the lower half of the pelvis and tends to be harder to find during pregnancy. So this is targeting both releasing the posterior pelvic floor and helping you find internal rotation. This can also be a good position to get into as you are laboring, when baby's getting lower in the pelvis, to help you create more space in the lower half of the pelvis as well. And you may find that you intuitively find movements like this as you are laboring.